This is a 37-year-old male who came in complaining of weakness. Now, again, focusing on the weakness complaint because weakness can be so many things and a lot of them are bad. So again, realizing that a male coming in complaining of feeling weak, it takes a lot for a man because we teach in our society, right? Men are not allowed to be weak. So when they come in saying those words, it should perk your ears up a little bit to, hey, what's going on? So his vital signs are abnormal. They get an EKG and here's what they find. They find that he is a heart rate of 151. He is in AFib with RVR because AFib with RVR. So anybody who has a heart rate over 100 who's in AFib is called rapid ventricular response. And you can clearly see that there's an asterisk in the PR interval, which is often seen with AFib. And if you look, you can see that it's irregularly irregular. This is a rhythm strip provided for you down here. But the question then becomes, why is a 37-year-old male weak and why is he in AFib? So the three things that should come to mind for you is obviously drugs. We're always thinking about that. Number two should be get a thyroid, get a TSH, because it could be thyroid storm. And you also have to look for Wolff-Parkinson's White. So you have to look for delta waves because patients that are young and that come in new AFib, a lot of times can be as a result of a Wolff-Parkinson's issue so there's an accessory pathway and the impulses are just flowing down it and it can create an AFib or an SVT. So they treated the patient, got his heart rate down after they cardioverted him. And then you can see that now he does have a PR interval. He's in normal sinus rhythm. His heart rate's normal. He doesn't have a STEMI, so that's all very reassuring. And you need to look closely for the Wolff-Parkinson's White delta wave. I like to use V4 and V5 and V6, but they can be found in any lead. But what you're looking for is a widening of the QRS and a slurred upstroke, which he doesn't have. You'd also have a wide QRS, meaning a QRS over 120 in duration. You don't have that. You also don't have the short PR interval, less than 120, that you'll a lot of times have with a Wolff-Parkinson's White. So we don't think this was Wolff-Parkinson's White. His UTOX was negative, but his thyroid, he was in thyroid storm. That was the ding, 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 winner in a chicken dinner thing on him. And so we wouldn't have checked it if we didn't think about it. So again, just add this to your differentials for any new young person who comes in AFib with, especially with RVR, get a TSH.